Medical research is used to lengthen and improve the quality of life of the population. New advances in medical treatment are often driven by conducting research using volunteers from the population. The people who volunteer for these studies should be educated on the risks involved from the researchers. However, that was not the case in the Skid Row cancer study. Before the 1950s, the primary method for detecting prostate cancer was to perform rectal exams. Early detection and effective intervention to treat prostate cancer was lacking, leading Dr. Perry Hudson to pioneer a new method for the diagnosis and treatment of prostate cancer. In 1951, Columbia University researchers recruited over 1,200 homeless and alcoholic men from the Bowery, also known as New York City's Skid Row, to participate in the study. These men were brought to a newly opened public cancer hospital and underwent highly invasive tests and procedures, which included open perineal biopsies of the prostate gland. If the biopsies tested positive for cancer, these men were subjected to prostatectomies, surgical castration, and estrogen treatments. These surgeries were much more aggressive than those typically performed at the time, and due to the untested and painful nature of the surgeries, researchers had difficulties recruiting willing subjects into the study. Researchers could not conduct these experiments on the private patients of the nearby Columbia Presbyterian Hospital due to their increased autonomy and dignity, leading them to prey on the poor and desperate men living in Skid Row. These men lacked the competency to understand the risk-to-benefit ratio, and they might have been desperate enough to take the risk due to their vulnerability. The ethical problems present in this study include a lack of informed consent and taking advantage of vulnerable populations. The researchers were fully aware of the lack of education and reduced mental capacity of the subjects involved in this study. Participants did not fully understand all of the risks and complications that could occur following the dangerous medical procedures, such as a risk of impotence, rectal tearing, and even death that occurred to one Bowery man following his perineal biopsy. Furthermore, the subjects who tested positive for cancer were incentivized to participate in treatment by being offered the free procedure and a 4 to 5 day stay in the hospital with clean sheets and 3 meals a day. However, these incentives were only given to participants when they reported to their appointments for treatment. Prior to this study, prostate cancer was treated as an incurable and terminal disease. There were no tests done to provide early detection, and by the time the cancer was detected, it was in such a late stage that the patients had no hope for a cure. Dr. Perry Hudson wanted to change the stigma around prostate cancer by creating a means of early detection of prostate cancer by performing the perineal biopsies and then testing out treatments to rid the patients of cancer. Dr. Hudson's experiment did not have any immediate effect on the world of medicine because the perineal biopsies were deemed too invasive for the normal population. However, Dr. Hudson influenced the change in the medical world surrounding prostate cancer, taking away the pessimism and making it viewed as a curable disease.